R-Natal Ob is a medication that is a combination of multivitamins, minerals, and fatty acids. It is used to treat or prevent vitamin deficiency before, during, and after pregnancy. These vitamins, minerals, and fatty acids are essential for maintaining good health and are important for the body's overall well-being. In addition, this medication also contains iron and folic acid, which are important for women of childbearing age to prevent infant spinal cord defects in the developing baby. It is recommended to take this medication as directed by your healthcare provider, usually once a day. It is best to take it at the same time each day to help you remember. Be sure to follow the instructions on the label and consult with your doctor for the best timing for you. When taking R-Natal Ob, you should take it by mouth, usually once or twice daily as directed by your doctor. If you are taking the powder form, mix it in water before swallowing. If it's delayed release, do not crush or chew it. It's best to take this medication on an empty stomach, 1 hour before or 2 hours after meals, with a full glass of water. If you experience stomach upset, you may take it with food. However, avoid taking it with antacids, dairy products, tea, or coffee within 2 hours before or after this medication, as it will decrease its effectiveness. Remember to take it at the same time each day to get the most benefit from it. Some common side effects of R-Natal Ob include constipation, diarrhea, or upset stomach. These are usually temporary and may go away as your body gets used to the medication. If these effects persist or worsen, it's important to notify your doctor or pharmacist. The iron in this medication may cause your stools to turn black, but this is not harmful. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, you should contact your doctor immediately if you experience any serious side effects, such as easy bleeding or bruising. While rare, a serious allergic reaction to this drug is possible. Seek medical help right away if you experience symptoms such as rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not listed here, be sure to contact your doctor or pharmacist. As for the best timing to take this medication, it is usually recommended to take it with food to help prevent upset stomach. Be sure to follow your doctor's instructions regarding the daily dosage and timing of R-Natal Ob. It's important to keep R-Natal Ob out of reach of children, as accidental overdose of iron-containing products can be fatal in children under 6 years of age. If an overdose does occur, it's crucial to seek medical help or contact a poison control center immediately. R-Natal Ob is a prenatal vitamin that is specifically designed to support the nutritional needs of pregnant and breastfeeding women. It contains essential vitamins and minerals, including iron, folic acid, and other key nutrients to promote a healthy pregnancy and ensure the proper development of the baby. It is recommended to take 1 R-Natal Ob tablet daily, preferably with a meal to help with absorption. The best time to take it is in the morning, as some women may experience nausea if taken on an empty stomach. Be sure to follow the dosage instructions provided by your healthcare provider to ensure you are getting the optimal benefits from this medication. Before taking R-Natal Ob, it's important to talk to your doctor or pharmacist if you are allergic to any of its ingredients, fish or soy/peanuts, or if you have any other allergies. Also, make sure to inform your doctor or pharmacist about your medical history, especially if you have iron overload disorder, alcohol use/abuse, liver problems, stomach/intestinal problems, vitamin B12 deficiency, or bleeding disorders. If you are planning to have surgery, let your doctor or dentist know about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. R-Natal Ob is safe to take during pregnancy when used as directed. It also passes into breast milk, so consult your doctor before breastfeeding. The recommended daily dosage of R-Natal Ob and the optimal timing for taking it will be determined by your healthcare provider based on your specific needs and medical condition. Be sure to follow their instructions carefully. It's important to be aware that R-Natal Ob can interact with other medications you may be taking, which could affect how well they work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Don't make any changes to your medication dosage without consulting your doctor first. Some products that may interact with R-Natal Ob include chloramphenicol, certain anti-seizure drugs like phenytoin, and methyldopa. Additionally, R-Natal Ob can decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. To avoid any issues, it's best to separate your doses of these medications as much as possible from your doses of R-Natal Ob. Ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If you or someone else has taken too much R-Natal Ob and has serious symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. It's important to note that R-Natal Ob should not be shared with others. While taking this product, you may need to undergo lab and/or medical tests, such as a complete blood count and checking your vitamin B12 levels. Make sure to keep all medical and lab appointments and consult your doctor for more details. Some brands of prenatal vitamins also contain additional ingredients like calcium, zinc, iodine, or docusate. If you have any questions about the ingredients in your specific brand, it's important to consult your doctor or pharmacist. It's crucial to remember that R-Natal Ob is not a substitute for a proper diet. It's best to get your vitamins and minerals from healthy foods, so maintain a well-balanced diet and follow any dietary guidelines provided by your doctor. If you forget to take a dose of R-Natal Ob, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. It's important to take R-Natal Ob as directed by your healthcare provider to ensure its effectiveness. Remember to store R-Natal Ob at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When you no longer need it or when it's expired, make sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for guidance on the best way to do this. And remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.